Hello, future colleagues. I'm Dr. Sarang Suresh. Today we're going to tackle one of the trickiest spots in all of dentistry, that little space between the teeth, the proximal surface. Getting this right is absolutely critical.
So, here's our game plan. We'll start with the fundamental problem, then take a little trip back in time to the age of amalgam. After that, we'll see how the composite revolution changed everything, and we'll wrap up with what the actual evidence tells you to do in your own practice. Okay, let's dive right in. Before we even talk about materials or tools, we have to ask a basic question. What are we actually trying to accomplish with a Class 2 restoration? It's about so much more than just filling a hole.
Now I want you to burn this idea into your brain. A proximal contact is not a single, tiny point. It is a broad surface area, and it changes over a patient's lifetime. Your primary job, your #1 goal, is to recreate that surface perfectly.
Why is it so important? Because a proper contact does all of this. It's not just passive, it's an active guardian. It stabilizes the whole arch, it shields the gums, it keeps food from getting packed in there. It's a vital part of a healthy, functioning system.
And this is what happens when we fail. I need you to remember this in the clinic. An open contact is not a minor imperfection. It's a doorway you've just created for disease. You are either preventing pathology or, and this is harsh but true, you are creating the conditions for it.
All right, so to really get a handle on the tools we use today, we have to go back and understand the material that started it all. Good old dental amalgam. You see, all of these inventions were driven by one thing: the physical properties of amalgam. This was a material you literally had to pack into place with a whole lot of force, so you needed a tool that could contain it and withstand that force.
And this is that evolution in action. On the left, you've got an early screw device, the ivory #1, and on the right, the Tofflemire. This thing was so brilliantly designed that it became the absolute standard of care for decades. You will still see it everywhere.
The genius of the Tofflemire was its simplicity. It basically built a fortress wall around the tooth. This rigid band was the perfect partner for amalgam because it allowed you to really condense that material hard and get a decent contour and a nice, tight contact. But then everything changed. Patients started demanding tooth-colored fillings. Along came composite resin, and this shift toward aesthetics threw a massive wrench in the works. It created a whole new set of problems we had to solve. And here is the absolute heart of the issue. Look at the physics. Amalgam you pack down, it pushes out, and it even expands a tiny bit when it sets. Composite does the exact opposite. You can't pack it, it's sticky, and this is the killer. It shrinks when you cure it. It literally pulls away from the matrix band. That's the problem our old tools just couldn't handle. So this became the million-dollar question. If your filling material is actively trying to pull away and create a gap, how on earth are you supposed to get a rock-solid contact? The old way was never going to work. And here's the brilliant solution. We had to completely change our thinking. Instead of just building a wall to contain the material, we started actively separating the teeth before we even placed the composite. This ring uses powerful spring force to physically push the teeth apart just a little bit. You fill that space, and when you take the ring off, the teeth relax back together, slamming shut against the composite and overcoming that polymerization shrinkage. It's genius.
And that thinking led to these incredibly sophisticated sectional matrix systems. They use these super thin pre-curved bands that perfectly mimic natural tooth shape. And they're held in place by these powerful rings, often made of space-age materials like nickel titanium, all working together to help you build a restoration that's truly anatomical.
Okay, so you have these amazing new tools, but as clinicians, you can't just follow the latest trend. You have to be guided by evidence. So let's look at what the actual research says about which system works best. The data is crystal clear. When you're using composite sectional systems with rings, give you significantly tighter, stronger contacts, period. But, and this is a huge but, look at that last column. They also have more potential for overhangs. That beautiful anatomical form comes at a price. Your wedging technique has to be absolutely perfect or you're going to create a new problem. Now I want you to let that sink in for a minute. This is one of the most important things you'll learn. The tool you choose and how you use it, your technique, has a bigger impact on the final shape of your restoration than the fancy, expensive composite you're using. Your skill matters more than the material. And this quote just says it all. This is the key takeaway from our entire discussion today. If you try to use old tools that were designed for amalgam to place modern composite resin, you are setting yourself and your patient up for failure. It's not just a little bit worse. It's a direct route to iatrogenic disease. So at the end of the day, knowing all this is only half the battle. You have the evidence. The real question is, what are you going to do with it? Your success, and more importantly, the long-term health of your patients, will come down to the hours you put in, developing the hands-on psychomotor skills to apply this knowledge perfectly for every single patient, every single time.